Managing chronic disease is a challenge for both patients and doctors. Chronically ill patients have to do a lot of data gathering from different places and organize this information. Marla has to manage lab results, hospital and clinic visits, medications, and medical devices at home. Patients like Marla feel outside the process and not directly involved in their own care. In the meantime, care providers like Dr. Harvey want to keep a close eye on patients with chronic diseases who need to be more constantly monitored. Doctors need to review their patients' EHR, lab results, treatments, medications, and vital signs, and spend a lot of time on the phone in order to make better medical decisions. Today, doctors have to navigate on different platforms, from EHRs to paper to consultations. Both of these situations leave doctor and patient confused. Let's take a closer look at the patient Marla. She is a 43-year-old female with long-standing uncontrolled high blood pressure. She receives medical care at several different facilities with numerous providers. Marla's daughter, Karen, helps coordinate and explain the care to Marla. Marla also uses a home monitoring device to check her daily blood pressure readings. This device is not connected to any systems and so not visible to her providers. Additionally, Marla often shares with her doctor how she finds it confusing and time-consuming to monitor her own records across disparate patient portals. Studies have found that patients fully engaged in their own care are more likely to maintain treatment plans, track their health, and ask their providers questions. In this context, Marla's doctor, Dr. Harvey, recently introduced his patients to HealthShare Personal Community as the new patient portal. Personal Community offers a single point of access to personal health records, regardless of care settings. A composite health record offers patients and families the ability to access data, make appointments, fill prescriptions, and contact their providers in multiple formats and from many care settings. Let's see how Personal Community improves Marla's engagement with her own care and her communication with her daughter and her doctor. Marla no longer has to remember different logins to access the multiple systems she needed previously. Now she only needs Personal Community to access her clinical information. Personal Community displays a user-friendly overview of her clinical record with a timeline. This timeline contains appointments, lab results, medication information, and more. It also helps Marla go back to her past events and review her data. She can also view her future events, simplifying the complexity of her clinical data. When she logs into Personal Community, she can easily request a refill prescription and can message her providers. Her doctor can access the same data and adjust her treatment plan or schedule a phone consultation with Marla. Using Personal Community's proxy functionality, Karen is also able to review her mother's medical information and receive messages regarding her mother's health. During the phone conversation, Marla and her doctor review the medical record together. In the consultation, Marla finds out that her sodium intake is too high. Her doctor suggests that she review the educational materials on how to reduce it. He directs her to resources available within Personal Community. Marla is able to learn about her condition and consider new dietary habits. She is also able to select all or part of her clinical record download and print or send it electronically to her care providers. This allows her to communicate easily with her cardiologist, Dr. Rubens. Her contact with her care providers helps her avoid costly medical visits, emergency visits, and possible admission to the hospital. Later that day, Karen calls Marla to discuss the record and the doctor's recommendations. Personal Community puts Marla back in control of her own care. It also empowers doctors to be more involved in their patients' health care. Personal Community can reduce errors, improve communication, and promote informed decision-making. Personal Community allows a parent or guardian to set up a proxy account so they can actively participate in their family member's health plan. Personal Community helps everyone in the patient's community actively engage in the patient's care.